guys, good evening. If you are in America, good evening. And if you are in Philippines, magandang umaga. It's morning right there. And also, salam alaikum to all my friends and colleagues in United Arab Emirates and Saudi Arabia and Ramadan Kareem. And you are here with our thanks God it's Thursday. So guys, every Thursday, we highlight innovators, academicians, therapists doing well in their fields. We have lots of educators before. And for tonight, we're going to discuss more about a different nonprofit organization, and lots of international physical therapists are looking forward to different resources. And now we have the facts for the foreign academic credentialing tool services. We have the chief operating officer. And Vrunda is also, Dr. Vrunda is a doctor of physical therapy. She's a physical therapist and master of science. She's based in North Carolina. We will learn more from her, and she is right now in a setting of in outpatient vestibular. If she's working in a clinic, and if she's not working in a clinic, she is the COO of FACTS. So without further ado, we would like to learn more from Dr. Vrunda, based in North Carolina. And welcome, Dr. Vrunda.
Hi, Dr. Jenny. Thank you for having me. And hello, everyone. Nice to meet all of you.
Yes. So thank you so much for your services. Thank you for your time sharing this, all your knowledge. And we would like to learn more from you. And we know already that you're a physical therapist like majority of us. And congratulations, you're also board certified specialist in orthopedic. And in your outpatient setting, it says that you are doing some neuro and vestibular and also the orthopedics. So can you tell us more about yourself? Because I'm sure I didn't tell everything, right?
Sure. So, my name is Vrunda. I'm originally from India, and then I moved to the US to pursue my master's in rehabilitation science with a focus on neuromuscular physical therapy. And I'm just passionate about all things physical therapy. So I currently, like you mentioned, work in outpatient orthopedics as well. So I've been quite blessed. A lot of my education is based in neuro. A lot of my clinical experience is actually ortho based. So from very early on in my career, I've been exposed to all the different specialties. So that has been really good. As a globally educated physical therapist myself, I am very passionate about global education and opportunities for other global PTs like myself. And that's the reason I am involved with FACTS, which is a nonprofit organization that works with global PTs in the US.
Wow, thank you so much. So we are all global PTs, right? We talked
Yeah.
about that I work in United Arab Emirates, Saudi Arabia, and I'm based in Philippines originally. So welcome as well. So it's really
Thank you.
nice to see different or multicultural diversity. We talk about that as well. So with the facts, how does it come up? So where does it originate,
Sure. So FACTS is actually, as far as I know, FACTS is actually the first and the only non-profit organization which is created for foreign trained physical therapists by foreign trained physical therapists. So we're a 501(c)(3) non-profit organization. The way FACTS was formed is our current board of directors, which consists of PhD professors and then our executive team. We realized that a lot of students who were basically going through the process of the licensure process in the US, which we know can be a little bit tedious. We kind of realized there were a lot of hoops to jump through, and there were very limited resources available. Just to share a little bit about myself, it took me about 18 months to get my PT license, when later on I realized I could have just done it in 6 months. So I just, spent 12 extra months just because I didn't really have the right guidance and the direction that I needed. And that's the reason the founders of FACTS actually formed FACTS for PT, which is Foreign Academic Credentialing Tools and Services. And the goal was to reach as many foreign trained PTs as possible who are kind of going through the process, and just to help them. And that's the reason it was formed as the 501(c)(3) nonprofit. So yeah, that's how Facts was formed. It's just based on people's experiences and people realizing that we need to come up with a solution. So
Mhm.
yeah.
That's true. We need to have a problem first, and then later on, the solution will initiate, and there's originate some of the wonderful organization that will be the solution for all those kinds of problems, resources, So you will be the
True.
resource for all the different international or foreign trained therapists. So what do you do? Let's say, is it the licensing? You will help and give them resources, what the different requirements for the states. How about the testing as well? Like, these are the requirements for testing. Is it something like that? Can you tell us more?
Yeah, it's actually exactly everything that you mentioned.
Ah, I'm
So
so
with
good, huh?
true, we're like a one-stop shop for everything,
Okay.
right? So the first thing that we do is we have these champions from different countries. So we have team members from the Philippines, we have team members from the UK, we have team members from India. So all the like people who come from different countries. We have team members who are citizens, and then we have team members who came on a student visa, right? So everybody, the whole team is kind of aware of the process. Like as a team, we all know like all the different processes based on our experience. And we even keep in touch with the state boards when it comes to learning about the rules and regulations of the various states. So one of the main things that we do is we offer consultations, which is we match you with an advisor. So if you come to me and you say that, hey, listen, I want to start with the licensure process. Which state is the easiest? So based on your background, your credentialing, your long-term goals, we kind of recommend, okay, maybe you should go with this state and these other state specific requirements, right? Or if say you're already licensed and you want to endorse your license from one state to another, we also help you with we also inform you about what are the various state specific requirements and how to transfer your scores and things like that. As you may be aware, with foreign trained physical therapists, when you go through the credentialing process, you actually also have to sometimes take a lot of courses to kind of be
Yes.
eligible to either endorse your license or be eligible to take your license exam.
Mhm.
And a lot of times, students don't know where to do those courses from, or the courses are very, very expensive, or it's just there's not a lot of information available. So the one thing that we do at Fax is we have something known as post evaluation advisor. So once you finish your evaluation with a credentialing agency, and if you have any deficits, you can come to us and we will help you figure out not only which school you can do it from, because a specific course can be taught at multiple different schools, right? But we
Mhm.
actually help you figure out which school is going to be the most pocket friendly option for you.
Nice. Yeah.
In addition to that, being a 501(c)(3) nonprofit, we partner directly with schools. So if you take a course at a partner school, you actually also get 10 to 20% discount on those courses, depending on which school you go to. And that's directly between you and the school. Like the whole 10 to 20% goes to you. And that's another advantage. Like that's something else that we assist with. So, like I mentioned, it's everything that you mentioned, like just going through whether if you want to know what the steps are for licensure, or what the steps are for to endorse your license, or just how to get started, or like you've gotten started but now you're stuck because you don't know where to do the courses from, or if you know where to do the courses from but they're too expensive, we can actually help you at every step of the way.
Nice. Does majority of your let's say students or clients or therapists, they already pass the board exam when they approach you, or not all?
So majority of them are actually just getting started with the process, and we kind of help them like go through the process, go through the credentialing, guide them through like various steps and everything, and then they become eligible to take the license exam.
Oh, okay.
um
Mhm.
yes,
So
so most of
not
our clients
all.
are, yeah, they haven't taken the NPT yet, but we do with people who are endorsing their license, they're obviously already licensed in the US, and then they work on endorsing the license.
Okay, so you help both ends, like from A, which is like they want to do the board exam and they want to begin from A, like A to Z.
Correct.
So it's the beginning. How can I pass the board exam? I need a license, and this is the credentialing. And there are also some people or therapists who just pass the license and looking forward That's why you said endorsement. Yes, yes.
Correct.
So that's how we call it, the endorsement of their license. I want to be in this particular state. What are the
Right.
requirements? Oh, okay. So there are different cases, right? They really need an advisor for that. Yeah.
That's true because as you
Mhm.
may know in US every state almost every state has different set of rules, different
Yes,
requirements,
yes.
right?
Mhm.
And then even based on your visa status, the rules vary, right? If you're already a citizen, there are going to be different rules applicable to you. If you're a green card holder, the rules are different. If you are on
Mm,
a student visa, the rules are different. If you're an H-1B or like a work visa, the rules are different.
okay.
So if you're a Canadian citizen, the rules are different. So the rules are different for everyone. So we kind of try to help. And that's the reason we have a diverse team, because that way we can kind of help as many people as possible.
That's good. So what is the most challenging, Brenda, that you encounter? What kind of visa do you think is a little bit challenging? And if they have a choice of what kind of visa, what do you want them to have?
I think it really depends, right? With respect to the visa, it really depends on the country. A lot of countries have like a country specific visa, right? For like Canadians, they have a TN visa, which Indians, Filipinos, and people from other countries don't have, right?
Mm.
So, what I have seen based on my experience is a lot of people either go with a student visa, if, of course, if they're coming to US to go to school, like if they're coming to US for their higher education, they come on a student visa and then they go through OPT, which is which is like you can work for a year or 3 years depending on which course you did. So you can actually get an OPT and then you can work without a work visa for 1 to 3 years and then you apply for a work visa. So that's something that I feel like has worked out really well for a lot of students because it gives you the opportunity to work in the US and then you also get the opportunity to study in the US. And then, of course, everything that you study is going to be very applicable when you go out in the clinic and you're practicing.
Nice. When you say, I remember the different courses to improve your eligibility. I did that. So I came from Abu Dhabi, but I have an agency, so that's easier, right? But still, my agent told me, Jen, try to increase the subjects and get more courses. So I did like cultural diversity, a little bit of something that I didn't have on my transcript, and then it's 3 different courses, and I took that in Philippines. So
Right.
there's a specific school that does that. How about your resources? Are they in India, Philippines, and US, or where are those schools that you affiliate with?
Yes, so we actually partner directly with US based institutions.
Okay.
Almost 99% of the courses we recommend are online. So even if
Yes.
say you're in Philippines or if you're in Australia or if you're in the UK and you start your process from there, like if you start your process from your home country and if you have any deficits, like we do help you with options that are online and they're all US based universities. So they are accepted by the credentialing
Oh,
agencies.
okay. So even they are Filipinos, so you are, so doesn't need to be a school in Philippines. So it can be in the US base. Okay.
US.
Good
Yeah.
to know. Yeah, because for me, I was in Abu Dhabi that time and I need to enroll in the, which is you said online, which is true. And then I need to enroll in Philippines, so it's easier, things like that. And they will going to process it in, I think, FCCPT to send those additional course. Yeah, that's the reason why when I first heard about you guys, the facts, I said, oh, it's really close to FCCPT. Maybe they're like a subsection of that. So because and then that's why it's really good to know you guys, especially lots of people I have more connection in Philippines. I don't know anybody yet too much in Canada, but I have many colleagues and also clinicians in Philippines asking resources. And then when I asked David about the NPTE Final Frontier, and he told me that you have these resources, and then I said I will connect with you. And I even have one therapist. He is already asking me about New York. I said the requirements. So I said I will connect you, and then I'm just waiting for us to talk about this. So I will definitely connect you with him. So can you tell me, like in that small case, Brenda, can you tell me more about, is it true like the New York, when you have the New York, it's easier to have it compared to the other, I forgot what is that they're taking in New York and easier. Let's say FSBPT. No.
The NYC,
FCCPT. The
right?
FCCPT and the NYC. And then they said that it's easier in New York compared to FCCPT. But I told him you will be only in New York. But if FCCPT, you have different states. So, but how does it work? So he can choose.
True. So for each state follows a coursework tool, which we call the CWT, right?
Mhm.
And think of coursework tool as like a checklist, right? So that checklist includes all the courses that US trained PTs study, right? So when you go through the credentialing process, they take your syllabus and they compare your syllabus with this checklist, which is your coursework tool, right? And then
Yes.
there are different versions of the coursework tool that different states follow. So with New York, it's a little bit different. So even if the student you're talking about or anybody else, even if they want to go to New York, they still have to go through FCCPT. So FCCPT will collect their documents, and then FCCPT will send it to the New York State Board, and New York will basically do the evaluation process. That is true only for New York. For all the other jurisdictions, FCCPT itself will do the evaluation. But just for New York, it's the New York State Board that does the evaluation. And that's the reason it's a little bit different compared to other states. And like you mentioned, right, if you have a New York eval, it's valid essentially only in New York. You cannot easily endorse it to another state. If, say, you want to go from New York to Maryland, you will have to go through FCCPT and get the evaluation done for Maryland. So yes, it is easier to get licensed in New York compared to other states just because the evaluation is done by NYC.
Oh, okay. That's really confusing to some, especially that will be their first time applying. So that's really good. So thank you so much, Brenda. This is really informative. And I'm sure that there will be lots of questions. I would like to learn more and do another webinar open to, like open to the students or to the clinicians, because they will just ask question and answer. Because right now, I'm limited. I didn't even experience that. I just
True.
talk to one person and they do everything for me. And I am an immigrant. Like I have a
Right.
green card visa, and then they house me. I took the test, things like that. I took the test. I failed the test. I took the test. And then
Oh,
I won, and we waited. And my daughter was in Wisconsin while I'm studying, passing the test.
oh,
So it will be a different really route. But this is coming from no agency. They want to just do it their own. So they want to know more. So how can they connect with you?
sure. So if you look up www.faxpt.org, and I'm happy to put it in the bio as well. So that is essentially our website, and you can reach out to us through our Facebook page as well. It's called FACS, which is Foreign Academic Credentialing Tools and Services. And I'm happy to share my email address as well. It's my first name, Vrunda, ptdpt@gmail.com. And that's another way to connect with us.
Okay. Yes. Thank you so much. And do they need to pay or do something in return of the different resources you give, or the, what do you call that? The mentors that, or the coach that they will have, so they know?
Sure. So we actually conduct free live webinars almost every month. In addition to that, our website has a ton of free resources, and we also have a YouTube page where we post a lot of free videos. If somebody wants to meet with an advisor one-on-one, we do offer Zoom calls, which we call it as a consultation. So that is a paid service, but it's pretty reasonable compared to a lot of other options.
Okay.
First of all, there are no options out there, but it's still pretty reasonable because we are a nonprofit. And even with the school partnerships and stuff, it is a service that they have to sign up for. But essentially, the school discount that they get through us kind of offsets the cost. So they basically still save money.
Okay. So the consultation will be paid because
Right.
they get your time and then things like that.
Correct.
And then
Yeah.
they will save with a different affiliation of the universities that they will use somewhere. All right.
Right. So
But
depending on
you
what
have,
deficits they have, we
yes.
match them with universities.
And then, but you have different free resources, YouTube and free live webinars. Awesome. All right. Very fair enough. So because you have all your knowledge and you have your time, better, at least they can help you. And then that's a really good nonprofit organization you're doing this. So thank you so much, Vrunda. Definitely, I will connect you because I have a gentleman here. We just connect via Messenger. So some of them are not really students. They're all licensed physical therapists in Philippines. He's doing home health, and then he's in the process. And definitely, these are very informative. And I know at the back of their minds, they have more questions because they're in the process for that. And I did a live webinar one time for different agencies doing that as well. So they have different questions too. So in the future, I'll connect with you again. So they will be the one asking to you because I don't know what to ask. I have only one question for that particular clinicians. So thank you so much for your time. And I hope you have time in the future if I will be able to do a time with them, and then we'll see for the set time frame. All right.
Absolutely. I'm happy to help in any way as possible. And thank you so much for having me. I admire your work, and I admire the fact that you have your own channel and you're trying to reach out to so many different physical therapy colleagues. So I think you're doing great, Jenny.
Thank you. Thank you so much. Yeah, so I just want to highlight innovators, different, even entrepreneur, some of them, they have courses that will be very helpful. It's my pleasure to meet you and David because you help also different international clinicians to pursue their dreams coming here, and also just like us, right? This is how we begin, and now we're helping some of them. So that's really nice. It's my pleasure to meet you, Dr. Vrunda. Thank you so much for your time, and I'll connect you again. I will be doing a geriatric rehab summit, so there will be different therapists international who will be able to join that. So in the future, I will connect with you if I finish all the speakers, and because that will be a great tool too to learn more. All right.
Absolutely.
Thank you so much, guys. If you have any questions, I will post Dr. Vrunda's email, and also connect with the YouTube or live webinars of FACS, which is the Foreign Academic Credentialing Tools Services, a nonprofit organization. Thank you for your support, and keep in touch. So connect with us in PhysioGen PT and Wellness. It's me again, Dr. Jenny Yusuf, physical therapist, doctor of physical therapy, board certified geriatric clinical specialist, and vice chair of the Global Health in Aging Adults. I'm your founder of Balance and Falls. If you're still not checking out Balance and Falls, that's where we're going to post all our interview and the highlights. All right. Balance and Falls support group in aging adults. Bye for now, guys. Thank you. Have a great day.